Hello everyone. So this video is about breathing patterns. This is how a normal breathing patterns look. This is inspiratory phase and this is expiratory phase. A normal breathing is of around 12 to 16 breaths per minute with a tidal volume of 500 ml. In bradypnea, the respiratory rate is decreased to around less than 12 breaths per minute. Common causes of bradypnea are drug-induced respiratory depression. It can occur in sedation and use of hypnotics, diabetic coma, and increased intracranial pressure by a phenomenon known as Cushing reflex brings down the breathing rate. In cases of tachypnea, we have increased breathing rate of more than 20 breaths per minute. Common causes are infection, pleuritic chest pain, restrictive lung diseases, as well as it can be seen in case of heart failure. A patient with hyperapnea has increased amplitude of breathing. Means consider a patient having tachypnea with deeper breaths, so it becomes hyperapnea. So breathing rate will be more than 20 with deep breaths. Causes include Kussmaul breathing seen in diabetic ketoacidosis, uremia, salicylate poisoning, methanol poisoning, alcohol poisoning, and lactic acidosis. So it can be remembered by Kussmaul. Talking about another pattern seen in cases of obstructive diseases, we can see in these obstructive diseases because of air trapping, the expiratory phase is here prolonged. Okay, so obstructive diseases include asthma, COPD, and constrictive chronic bronchitis. In these cases, the expiratory phase is prolonged and the graph appears like this. Talking about three most important pathological breathing patterns, we will start with bitot respiration. This bitot respiration is seen in cases of CNS damage, the first thing we need to know. So, a bitot respiration occurs in case of damage to pons or medulla. These damages can occur following a stroke, trauma, or opioid abuse. The breathing pattern here is periodic breathing with phases of hyperapnea, normopnea, and apnea. Okay, so there will be variable tidal volume and no regularity in the breathing pattern in cases of bitot respiration. We already talked about Kussmaul breathing, that is a type of hyperapnea seen. Hyperapnea can also be seen in cases of ketosis, uremia, sepsis, salicylate, methanol, aldehyde, lactic acidosis. Talking about chain stroke breathing, it is something where pattern is going to repeat itself, chain stroke respiration. So this pattern is seen normally in elderly and children's, but it can be seen in hypoxemia, drugs, hypoperfusion of brain, and notice in children and elderly it can be seen in sleep normally. This breathing pattern is gradual hyperapnea and then gradual hypopnea, and this pattern is going to repeat itself. This is known as chain stroke respiration. So these were bits about a breathing pattern. Hope you liked it. Thanks for watching.